The unknown says, our confidence is naive. Compromise. Stick to the tried and tested. Your passion is aggressive, knowing that we are coming for everything, marching forwards in numbers, in ones and zeros. The past has no leverage on us. The present expected us to stand still, but time ticked our presence, with the future inscribing us into history's foundation, calling us by our names, including the clicks in our names and clicking of our fingers. Once not born with silver spoons in their mouths, are now makers of the spoon and benders thereof, came to this earth with answers clenched in fist, unclenching fist to be the answer. Ours is not a race to come first or be first, but to influence and impact us, energy injectors, conductors of creativity, dancers with the rain, proverbs for our posterity, signaling the speed of ideas, implanting innovation, setting standards a tradition. We are outliers, the avant-garde, belonging to secrets whispered in spaces unseen for fear of our splendor. We are resolutely spewing out stagnation, a slow poison for the norm, perplexing conformity. We're not taking up space only to be muted at the table, not just conduits between what should be and is, not just bodies trading into uncharted public realms, but we are tomorrow's tools, the manifestation of ideals unscripted, leaning on the reassurance of the rising of the sun the next day. Let he without foresight cast the first doubt, whilst we visionaries converge at Urban Festival 2020. Welcome.
Hi everyone, my name is Joel Mayepu, and I'm the chairperson of Tshwane Homelessness Forum, which is being constituted by all NGOs within the city that are working with homeless communities. But we also partner with universities, UP and UNISA, and the city of Tshwane. The World Homeless Day is an event that we've been doing for the past 5 years, since 2015, with our partners, UNISA, UP, and the city of Tshwane, after signing a social contract together to commit ourselves with regards to creating pathways for homeless people within the city. During the COVID-19 in March, there was a lockdown for the past 6 months, and we have been working with other partners to ensure that the homeless people finds accommodation that is decent, where they were able to get food to eat and a place to sleep, and also they will be able to wash themselves and be healthy.
Good morning, Desiree. We're coming live to you from the Caledonian Stadium in Pretoria, where over 1,000 homeless people are housed here in tents provided by the Gauteng province.
When President Cyril Ramaphosa announced the national lockdown for COVID-19 on 24 March 2020, in his speech he said that temporary shelters had to be created for homeless people. This surfaced many fault lines in the city and offered new opportunities. No national policy on street homelessness exists. Only one province and 2 municipalities have a policy that addresses street homelessness. Street homelessness is invisible in urban governance and is wished away by urban neighborhoods. However, after President Cyril Ramaphosa's announcement, it gained new visibility during the national lockdown. Street homelessness is complex. No one-size-fits-all approach can work. COVID-19 taught the power of collaboration. It demonstrated the possibility of ending street homelessness for chronic populations. It emphasized the importance of policy, strategy, and investment at all levels of government. It showed how homelessness is a public health issue, a housing issue, and a psychosocial issue. It showed that facing homelessness is facing myself and facing the institutions that govern my city. During the national lockdown, street homelessness surfaced kindness in some and hard-heartedness in others. Municipalities responded to the issue in vastly different ways, some through bold collaboratives and others in highly contested ways. In many cities, the aftermath of the national lockdown are new policy and strategic conversations, the possibility of funding and bed spaces not available before, a preparedness to think innovatively about partnerships, responses to street homelessness and substance use that are not criminalizing vulnerable communities, but centered on their humanity and dignity. We take you on a whirlwind tour of 6 cities and 6 responses. What you will hear is only the tip of the iceberg, and through the insights and voices of those we introduce you to. These are not the full stories. The layers are many and thick. But we see a crack, and in this conversation, we are inviting citizens to help in opening the crack even wider.
Talking to the interventions that we have implemented during the lockdown, with the first point being the gaps, the fault lines. My thinking is that the first gap was that the city by itself did not have established homeless shelters. And there was a lot of people who were staying in the streets, and it was a threat to the city that the people who are in the streets, in as much as everybody else needs to stay within their houses to avoid the spread of COVID-19, it meant that even those that are in the street homelessness needed to be in a secured place so that they can be taken care of, and they can also be able to take care of themselves. So the gap for me there was that there were no institutionalized or established homeless shelters for the city. But also one important element also as we went on, when the president announced the lockdown, and the decision was that even the homeless had to be accommodated in homeless shelters. It meant that there had to be quite a number of services that had to be provided. As the health department, we are responsible for the implementation of the drug and substance abuse response program within the city, and many of our clients has been the people who live in the streets, trying to intervene in their day-to-day lives so that we can be able to bring in integrity and improve the lives of the people so that they can find themselves in a better situation. But to be able to do that, it meant that the people had to be accommodated, firstly. And it came out that actually the city was not ready for that, and there were no specific accommodation places. And at the first point, some of the places where the people were like at the Caledonian Stadium, which was not really a conducive space. And although as the city, we then had to take up an intervention and put up temporary tents so that people can be accommodated in a decent way. But one of the gaps that came with that also was that as and when the people get to stay in those temporary shelters, they will not be able to provide a service to themselves in terms of what they are used to. And one of the things that they were used to was the use of substances. And if they are not able to access the substances because the economy is not working, and they are not in the space where they can be able to access whoever is a seller, it meant that they are going to face withdrawal symptoms. And those withdrawal symptoms came in a devastating way for them and for the officials of the city as they had to take care of the people.
The president made his initial announcement about the lockdown and specifically mentioned homeless people and the need for emergency shelters. I have to say, I was initially excited and then obviously a bit anxious. Excited because the homeless were the only marginalized group that got a special mention in that announcement. And we as the National Homelessness Network had been lobbying in advance, expecting a lockdown, lobbying that there should be some recognition of the needs of the homeless. So whether it was because of our lobbying, who knows, but anyway, they got mentioned. Anxious because we had to do something. We had to provide emergency shelters for homeless people here in Durban. The response in Durban was remarkably quick and remarkably efficient. And that was because we already had in place a forum in which the key players were talking to each other, were learning to work together and building trust with each other. That means the municipality, NGOs, academics, corporates, and faith-based organizations. This was a group called the eThekwini Task Team on Homelessness. It had been set up by the previous deputy mayor about 2 years ago, not with a lot of energy under her, but had gained a lot more energy under the new deputy mayor, Belinda Scott, who came into office September of last year. So when this announcement was made, I think it was a Monday evening, by 6 o'clock the next morning, the deputy mayor was on the phone to me saying, let's get the task team assembled so we can work out how we can deliver emergency shelters. And between Tuesday morning and Friday evening, when the lockdown began, we managed to put together emergency shelters for 1,500 people in central Durban, separating men from women and separating those who were elderly, sick or disabled from the general group. And it was possible to do that so quickly because effectively we had the combination of the expertise and the speediness of the NGOs, but also, to be fair, the resources and the money of the municipality. And that was really possible because the deputy mayor decided to give this, make it a major political priority and put her personal weight behind it. Now, of course, it wasn't all plain sailing. Our initial most obvious location was to use the huge Durban Exhibition Centre, which is a big, well-fenced area right in the heart of the city, lots of separate rooms, lots of covered areas, obviously lots of toilets and so on and so forth. And that seemed the perfect place to actually create the emergency shelters. And even though the Durban Exhibition Centre is owned by the municipality, they categorically refused to let us use it. Now, maybe in retrospect, they were right. We were planning for a 3-week lockdown. In the end, we ran the system for 13 weeks, and indeed parts of that system continue 6 months into COVID. But it was very frustrating that we had a solution right on our doorstep and we actually couldn't use it. What we ended up doing was creating for most people tents in parks, which were fenced off areas where people had indoor and outdoor space and access to toilets and ablutions and so on. But for the women and for the sick, elderly and disabled men and women, we had buildings that were brought online to use as shelters. I think we managed to do as much as we did because we had this very strong sense of shared vision and shared purpose. If I'm really honest, I think the municipal officials really didn't know what to do, and so they let the NGOs take the lead, and that's why we managed to get some things through that perhaps might not have happened under other circumstances. And we also had a number of things already in place. So, for example, the building which became the women's shelter was actually a municipal building that we had identified as the task team 18 months earlier as a potential women's shelter, and for 18 months, very little had happened apart from a bit of refurbishment. The emergency of the COVID lockdown meant we were able to bring that on stream straight away. In fact, a colleague of mine, a homeless colleague of mine on the task team, made the comment that we achieved in 3 days more than we'd achieved in the previous 3 years. So we were helped by the sense of urgency. We were helped, although in retrospect this may have turned out to be a bit of a problem. We were helped by this sense that, well, all money is available, so don't worry about budgets. I was a little, I have to say, surprised at how cavalier some of the budgeting was in that process. And we were also helped by the fact that Durban already has a very strong collaborative spirit between the different NGOs. So rather than the NGOs competing with each other to work on this, we were all working very collaboratively, one focusing on healthcare, one focusing on food, one focusing on... One of the things which certainly helped me through this whole period of lockdown and has helped our work in Durban has been part of a national homeless network. This is a network that we set up almost 3 years ago and has mostly been some informal conversations and an annual meeting. But because we had that group of people, again, already connected, during lockdown, we met virtually once a week, and it was a chance for us to sound off with each other, which is always useful, to hear what was going on in other cities, to learn from each other, And for example, in KZN, we built better links with both Richards Bay and Pietermaritzburg, who were having similar problems, obviously not so far from us, and we were able to reach out and help them. So having a network of people who knew each other, who could build trust with each other and could share information, proved to be a really useful part of this whole strategy.
So what was pretty unique was we're an NGO, Hope on These Streets. There were a number of NGOs that, as I had started making phone calls to find out, you know, is there anything happening with the homeless? What are these shelters going to look like? I got in contact with a number of other NGOs as well. And before we knew it, with the municipality, and out of that municipal meeting, we then all worked together to look at how things could go forward. So the municipality, our local Msunduzi municipality, King Tshwane, they supplied a venue, they supplied the security, they brought in cleaners, and as we met regularly, at least once a week, to look at what are some of the running logistics of a temporary shelter. Key was Department of Health. It was great. It was a little bit slow in the beginning to get our Department of Health, because they were facing so many other greater demands. And so we had a need within to look after the medical needs of those in the shelter. So for instance, a lot of the guys who are on our streets here in Richards Bay are on drugs. And so they had withdrawals. And so Department of Health then came in quite regularly, bringing in mobile clinics, sending ambulances when we needed to, as we helped people get off their withdrawals. The NGOs in the beginning started feeding those in the shelters, but then after about 2 weeks, Department of Social Development started feeding. They've actually been feeding and getting caterers in three times a day for the past 6 months. And so that's really been great to see. They've also helped with counseling, trying to find families. And then the NGOs in the whole process have taken over the oversight of the shelters. We've got somebody at our men's shelter here in Richards Bay. We've got a team that are looking after the ladies' shelter, just going in, making sure that spirits are uplifted for those who are staying in the shelters during lockdown, as well as providing clothing. We've been trying to do some skills development, selling earrings, upcycling of furniture. So a number of things have been going on. And I must say, there's been quite a few success stories. Day 2 of our shelters, we had 90 people. I think a lot of it was fear-based. A lot of those who were homeless, police were going around saying, listen, the army are going to come in the next couple of weeks and they're going to remove everybody. Everybody has to be in some form of a place of safety or shelter. And so second day, we went right up to 90 men. And getting all these men into our shelter. And we know there were many more in the bushes, but we realized after 2 or 3 days, they realized the police weren't coming for them. So a lot of them left just due to drug addictions. They couldn't deal with the cravings before Department of Health could be involved. But some of the successes out of the collaboration was for about 5 months, we've had 35 to 40 people stay permanently in the shelters who have come clean. It's been great to hear stories where, as people, those who are on the streets, have got out of their addictions, we've seen them, can they go home? The National Homeless Network, for us who have never run a shelter, we've been involved with the homeless in terms of feeding, but actually being responsible for people's lives, 24 hours. Being part of those meetings, I didn't give much, but I received a lot. Just hearing some of the discussions, also for those who had been dealing with the homeless for a long time, where they were able to actually give insights. They were dealing with struggles that we hadn't even thought about. And being able to share solutions to some of the stuff which is very elementary, and I was able to ask some questions, and they're saying, yeah, I remember that happening, and this is how we did, and this is some of the things that we've discovered.
We hosted the South African National Network for Homelessness last year here in Bloemfontein, and one of the reasons we opted to host it was, again, to get the whole issue of homelessness a bit more into the public space. And it was a good meeting, not only for those that came from other cities, but also of people, local participants we could get involved from other organizations, from the faith community. Some counselors were there. So I was very excited at that stage that we can take the next steps and form a bit of an organization. But you know, since November till March, beginning of March, we didn't pick up the ball fast enough, and then the whole COVID lockdown happened. So it was very good. It helped us, but the whole COVID lockdown experience just reminded me and others, that we must be intentional of building networks also in your city. Otherwise, it's not just going to happen on its own. I believe during this whole COVID thing, you know, even with the police, so again, as I said, even when they closed our soup kitchen down, and they were never nasty, even though they threatened to arrest us, but they were never nasty. You know, even one of the brigadiers even said, Pastor, we need you more than you need us, but you're contravening the regulations. And then at times they want to say, but there are no homeless on the street, they have to be in the shelters. And I said, no, they are there, they're coming to eat. They're not all in the shelters. So it just, hopefully for some of the police officers and some of the official dom, because they are good people. I mean, when the system is broken, doesn't mean all the people in the systems are broken. There's some real possibilities to go forward. So our challenge is to take, in this crazy times, to take the best out of it, and how do we move forward? But we have to be intentional. It's not going to happen on its own.
Yeah, I think the end of March, when the lockdown began, there was a lot of frustration amongst the NGOs. You know, we were keen to get involved, but we were struggling to get hold of the city. But by the end of April, as Mary said, you know, we were able to start task team. I think the city during that first month, you know, concentrated on turning recreation centres into temp shelters, and they also established the Wembley tented village. And then in the NGOs and FBOs, their response was to establish temporary shelters with permission from the city of Johannesburg. So during the lockdown period, which I guess would have gone deep into April, May, June, there were, to my knowledge, 4 temporary shelters established in the Randburg area, sort of northern suburbs, Johannesburg area. I think, though, that the feeling was that, you know, at most, only about 1,000 people were accommodated, which was way short of the 15,000 people that were estimated to be homeless in Johannesburg. I think on the sort of positive side, that we did establish the terms of reference, you know, and needs were identified, needs for project manager research, something to somehow monitor what was going on at the different projects, as well as to start to look to the future. But that only really became something probably in the last 2 months. I just think that we're at a critical point in Johannesburg. I can't, you know, talk for other places. We desperately, you know, the window of opportunity to obtain buildings for NGOs, in my opinion, is narrowing or closing. In 6 months' time, it could well be that, you know, we've all moved on from COVID, or we've learned to manage COVID, and suddenly the homelessness issue and other issues are not so important. So I think it's important in the next 6 months that we apply the right amount of pressure on the city to start releasing some properties that could be used for, you know, valuable social projects. So I think, if I to put in a nutshell, that is our #1 priority in Joburg, to get the people who guard the properties to release those properties.
As a member of the National Homeless Network, I think it is very important to firstly point out continually to the City of Johannesburg officials that the actual response to homelessness was as a result of our writing to the President ahead of his 23rd of March speech, and then declared in the Disaster Management Act, and that everything flowed from there. So the fact that we were actually proactive and advocated for the homeless, I think that was incredible. Being part of the national task team and having the weekly meetings gave one a lot of support, because I think while we weren't intending to be a support structure, we were trying to learn from each other. It became a very useful support structure to deal with frustrations at the local level, because one could see the bigger picture. One could see that this was happening here, and these were the struggles that were happening in another area of the country. And the fact that we were starting to look at like Gauteng policy and working together at Gauteng level, and also looking at what others could do.
During the COVID period specifically, there was, the most important thing was actually to keep people safe. The government promised, the city promised from the beginning that they will assist to have permanent shelters at the end of the period. But because the city was under administration at that time, and it was difficult, most of the decisions were not easily made, because the people who were supposed to make those decisions were either suspended, or they were, like if it's under administration, it was being managed by the province. And as a result, policy came into the fray here. Therefore, policy always becomes an issue in addressing homelessness in the city. And so during this period as well, it became clear that it is policy that is always a stumbling block in addressing homelessness. I'm not very optimistic. I am, for the short period I've been working on with homelessness in the city, I have realized that the political will is not in the right place. From time to time, it's very easy to talk and make promises, but when it comes to actual delivering on the promises that were made to the people, the powers that be is very easy for them to pull back. And the community-based organizations will not be able to do it alone.
The agenda that I have is a straightforward one, to continue my engagements with the provincial minister to ensure that within the next few months or year or so, we identify hard buildings that can be converted into proper, specific and tailored shelters for our homeless communities, to ensure that we work with stakeholders and service providers who are committed to developing and supporting our homeless communities in these facilities that are made available to these service providers. But very importantly, to ensure that the conversation that we're having at the moment and the development of the strategy that is taking place at the moment involves all of our stakeholders, from forums to shelters to service providers to homeless people, so that at the end of this strategy development, we have a world-class strategy that speaks clearly to the roles of all stakeholders and how these stakeholders, programs, infrastructure, and resources fit together to decrease the number of homeless people in our city. And I hope that it is a strategy that would be able to give guidance to this very same process in any number of cities in our country.
My vision and hope for homelessness, talking as someone who was homeless for 11 years himself, is having passion-driven social workers dealing with homeless people, seeing the system working the way it has to work. If someone is homeless, it's because their lives was altered in an unfavorable way, and he just needs a place. He's like in a desert. He just needs an oasis where he can relax, refresh, correct, and go back into society. from all of this, the way the whole world has came in, there's a lot of reporters who came to the areas in Tshwane from Spain. Some were coming from Belgium. The Australian radio the other time did confirm about the Caledonia thing and stuff. So there's a lot of attention now, or spotlight that's now given to the homeless people who've been in the dark but still in the light. So my vision is seeing transit shelters, seeing overnight shelters being there in each and every region in the city of Tshwane, where you have this one dealing with maybe women empowerment or something like that. But this is just a wishful way that I think my vision will put at that. But yeah, I'm when coming to this one, everyone has ideas and is envisioning on if you are given the right tools to show what we have to do to make everything to be at par per se. I know it's a fairy tale wish to say for everyone to be on the same level. It's an ecosystem. We cannot all be on an equal level, but we can strive to reach on that one. Minimize the misfortunes, minimize the injustices, minimize the cover-ups, minimize minimize a lot of things.
So thank you. Welcome back again. I would like to ask that those who are not panelists, perhaps just switch off your cameras, your videos, because some people have a more difficult time with bandwidth and connections, and that only the panelists would, it will be nice to see your faces at least, if that's possible. I see Malene and Wayne. Sasha, if you are okay to get on there, if it's possible, and Raymond, I will introduce you. Now, just to say, I would want to introduce our four panelists, and then I will just ask them maybe one or two introductory opening questions so that we can just get into the conversation, and then we'll open it up for participants. And the way I'd like to do that, just to make it easier, is to simply ask if you have a question or a comment at that point, that you will type it in the chat box, and I will try to do my best to not miss anybody. And we will then direct the questions and comments to the panelists. So the four people we have with us, we are very privileged to have you with us. Firstly, Malene Rousseau. Malene is from Cape Town. She's a lawyer by profession, also founded and directing the Women. Malene, now you must help me.
The Women Lead Movement, Stefan.
Women Lead Movement. Women Lead Movement. And Malene is a gender and women's rights activist. Right now, for the past few months, she's co-leading a process in Cape Town that is trying to assist the city, but actually trying to work with developing a new policy and strategy for the city of Cape Town. An exciting process. Thank you, Malene, for being with us on this call. Raymond Perrier, we already saw Raymond. So Raymond, you'll have less chance to speak now. But Raymond is director of the Dennis Hurley Center in Durban, and you've heard a bit about him, so I won't say more now. Wayne Renken is with the Tshwane Leadership Foundation and also secretary of the Tshwane Homelessness Forum. And Sasha Lala. Sasha works with the community-oriented substance use program, doing basically harm reduction programs on behalf of the city of Tshwane. It's a program coming out of the University of Pretoria. So thank you for the four of you for joining. And I want to start by just asking you to just say one sentence about, I've already said something, but maybe one sentence about your own connection at the moment to the homelessness issue. How are you coming to this conversation? From which place? So Malene, if you want to start, maybe in the same sequence that I've introduced you.
Hi, thank you very much, Stefan, and real pleasure for me to be part of this very important panel discussion this morning. So I am by no means a Nobel Peace Prize winner for the cause of homelessness. I've recently just been appointed by the city of Cape Town by Councillor Zahid Badruddin, together with my colleague, experienced leader Lorenzo Davids in the social development, to lead the pre-stakeholder engagement for a new strategy that the city of Cape Town would like to develop. I'm also an expert, in inverted commas, on public participation. So obviously, I felt that it was the right fit for me based on my experience. So I didn't necessarily know a lot about the homeless sector, but in the last 2 months, I have learned quite a bit just by observing, just by listening to the homeless people, by the NGOs, the challenges that they have, the gaps that's in the system. And I think, for me as a public participation expert, I genuinely believe that the voices of homeless people, the NGO sectors, etc., must be heard. In developing policy. So that is where I come in, and that is from the perspective that I would speak from today.
Oh, great. Thank you, Malene. So there's already a strong focus and assertion around the voices of homeless people, the voices of NGOs, and those who are actually providing direct services. Thank you. Raymond, in a similar way, if you can just say a line or two about your actual day-to-day involvement with homeless issues. Raymond, your mic is off. If you can just, yeah.
Yes, thanks, Stefan. So as you heard, I run an organization in Durban called the Dennis Hurley Center. So we're a multi-faith organization in the heart of the city. We're probably the single largest provider of services to the homeless, but work very closely in partnership. In Durban means very importantly interfaith networks. And we also work with the municipality, but also I hope keep sufficiently distant that we can critique the municipality and indeed advocate when the municipality fails to deliver. It's always an awkward situation to want to work with an organization, but also be able to speak out on behalf of people when they don't act. As you might have guessed, I'm not from Durban originally. I'm from the UK, and I have some experience of working in the area of homelessness, both in London and also in New York.
Thank you, Raymond. Wayne, Wayne Renken in Tshwane, if you can perhaps also just say a line or two about your own location.
So I'm full-time with the Tshwane Leadership Foundation, and I work as the secretary of the Tshwane Homelessness Forum. And I think I come to this conversation as was deeply immersed with the homeless community for a number of years now, engaging, starting off listening and engaging with people on the streets. And this last few months has been very deep learning and immersion and around broader systemic things and engaging the broader Tshwane. So my focus has always been within the inner city, but in the last few months it's been able to engage broader in the metropolitan and getting a better understanding and around the collaboration with NGOs, with universities, and with the city of Tshwane, and what does that mean to work in a collaborative space to address something as complex as homelessness.
Thank you, Wayne. Sasha, you coming in at it from a health perspective, perhaps if you can just say a little bit about your own location and COSUP and how it relates to street homelessness.
So I'm the petty functionary in COSUP. I have no medical background other than the fact that my mom was involved in health at the stage. But in terms of COSUP, my role is to work with existing NGOs and build the relationship in terms of the city of Tshwane when they were tackling substance use. They wanted to create a model that didn't reinvent the wheel, but looked at the existing NPOs and capacitated them in such a way that it would respond to substance use issues within the city. So they approached the University of Victoria, Department of Family Medicine, and through the principles of COPC and primary health care, I think an accessible primary health care, COSUP was born. The evidence around substance use spoke to a harm reduction, demand reduction, supply reduction based approach, also supported by the Drug Master Plan. And so within the Department of Family Medicine, and COSUP as a greater whole, I think what we found is, yes, there are push and pull factors into substances, but there was an immediate need to help people who are extremely vulnerable when it comes to substance use. And so, yes, we are trying to address issues that push people into substance use, but we also have a responsibility to serve those who are on the street and homeless. I think how we got into the COVID response is the Tshwane Homelessness Forum approached COSUP and said, listen, the lockdown is going to take place. We need to think creatively, and we need to start collaborating on how we're going to address the fact that there are going to be many people on the street. And then over and above that, I think the city of Tshwane eventually, the Department of Social Development requested that the DSA units and the relevant health departments assist, and the DSA unit, which oversees COSUP within the city of Tshwane, asked COSUP to attend to the withdrawal needs at the shelter and the primary healthcare needs and the screening needs. So I think COSUP went way above its mandate. And I was there, but not as a doctor and not as a social worker. I was there just to make sure, where COSUP could assist, and they would assist. So I hope that answers your question.
Thank you, Sasha. Thank you. I think I'm sure there will be lots of questions and comments as we go on. Of course, the whole harm reduction approach is an approach that some of us are passionate about, but there's also pushback from certain quarters. Maybe just a follow-up question to ask you, as you watched and listened to some of the voices in the documentary, maybe just what is the main impression, Malene, that you got from listening to very different voices all across the country?
Okay, so before I give you the bad news, let me just commend all the NGOs across South Africa for doing exceptional work in extremely difficult and uncertain times. You have done the best that you could under the circumstances. But the overall impression that I got from these videos, and obviously from observing this, throughout the COVID period, was that the South African society, and when I talk about South African society, I'm not only talking about the government, because we like to talk about the government only. I'm talking about NGOs and, just normal citizens. We are very reactive. We are not very proactive in terms of our responses. So when COVID hit, it was a chaotic situation. There was no national clarity, for example, on policy that deals with the disaster management in relation to homeless people. That was clearly lacking. We knew that the government didn't have the plan. And for the first time in a very long time, the government relied on the NGOs to do the work. And what is commendable is the fact that the NGOs, for the first time in a very long time, could come together, could collaborate, and establish these networks and really do the best that they could under extremely difficult circumstances. And the government was definitely reliant on NGOs. And if you look back at the fact that government doesn't actually support the work of NGOs in the sector, I mean, it was very clear through the Nkatalo processes that these people work in silos. They do the best that they can with what they know and what they have and the donations that they receive. But there's no coordination. There's no collaboration between the NGOs and between the government. And what I found very disappointed about is the fact that someone, for example, mentioned about there was a shared vision and a shared purpose. That shouldn't be the exception. That should be the rule. There should be a shared vision and a shared purpose, irrespective of whether or not COVID-19 is present or not. And I really hope that going forward, that would be, in fact, the way that NGOs and government would work together to have a shared vision and a shared purpose in dealing with the crisis of homelessness within South Africa.
Well, thanks, Malene, for that. Raymond, if you can perhaps also weigh in there. I think it surfaced a number of very, very clear challenges and vision in terms of going forward. Raymond, just your mic.
Yes, I entirely agree with you, Melanie, and I think we moved towards that in eThekwini quite slowly, but we were moving in the right direction. So as I mentioned, a task team was set up by the then Deputy Mayor 2 years ago now it was actually, that itself was reactive. It was as a result of a damning carte blanche program about the state of homelessness and the attitude of the municipality in Durban, which we as Durban NGOs had, of course, helped to facilitate. And to our surprise, and perhaps under political pressure from higher up, the deputy mayor said, we need to get people together to solve this. So it had a situation for a year and a half, where government officials, NGOs, corporates, academics were sitting in the same room on a regular basis, talking about these issues and beginning to learn our relative skills and our relative experience and moving towards a shared vision. So we were certainly heading in that direction. The frustration that we had was that even though we had a shared vision, or we were edging towards a shared vision, we didn't have a shared sense of urgency, and we didn't have a shared sense of how to bring that about. And so there was still very much a feeling that, well, the NGOs can give us the ideas and we'll implement. And of course, they couldn't implement and they didn't implement, and the NGOs were getting frustrated. So as I said in the video, COVID accelerated that process for us, both in good ways and in bad ways. Now, 6 months, 7 months later, and we're drawing breath, and I'm not sure how much of that has been a sustainable gain, and to what degree we're just reverting back to the model we were in before, where the NGOs do what they can with the limited resources that they have, and the government generally doesn't do much and misspends what it has. And that then causes frustration on both sides.
Thank you, Raymond. We will weigh in on some of what you say just now as we open up the conversation. But Wayne, perhaps if you want to, your main impression listening to some of the voices coming from the different places.
It's very clear that cities, civil society was more prepared in certain areas than in others. And in the cities where civil society has been organizing around homelessness longer, they were able to respond much quicker. But I think listening to the voices from all over the country, it is clear that the focus on homelessness during this last few months is we had to start almost from a place of scratch. Although there might have been organizing, there might have been things in place, but as Raymond and Melanie has rightly pointed out, that we had to, there was a response needed, and you work from a place where there's strong work happening, but now suddenly you have to do it on a broader scale. And I think it highlights the fact that the fact that for many years there's nothing been happening on a government scale around homelessness, or little to nothing happening. But it's also showed that if the political will is there, the collaboration is there, and the correct investment is there, we're able to address homelessness. That it's not this monster that must just paralyze us, but it is truly something we can do about. And then I think it's not as Tebogo ended off by saying with his vision, it's not something that we must dream of, that homelessness can end. And I think if we tackle with the same rigorousness and the same emergency that we've been tackling homelessness in the last few months, we will be able to get to a place in our country that we can say no one is homeless anymore.
Thank you, Wayne. Just before I speak to Sasha, is just, I think one of the challenges as I see it also is that we have to get our heads around the actual numbers, because I think we have some sucks. We overinflate the numbers sometimes thinking we do ourselves any good. I think we must get to the real numbers, because I think that will even help us see that actually we can go quite far in addressing homelessness, because it's probably even less than we thought. Not minimizing the challenge or saying it's less of a challenge, but I think that's an important challenge for us with Stats South Africa and others to actually get to a point where we know what we're talking about when we're talking about the number of people on the streets. Sasha, any specific impression that comes out for you that as you listened?
Well, just to add to the sentiment that the response, and I said the collective response, unfortunately not planned for in terms of the crisis, but the collective response when it started was impressive. I think there was initial, after the president's speech, it was slow movement, but then the collective response of NPOs in different areas of homelessness, substance use, sex work, mental health issues, it was inspiring. And even from a government perspective, to just say, okay, listen, you guys need to be there, COSUP must be there, they must be providing OST and health support, that was inspiring. I think one of the things that I heard from some of the panelists is there were still many people on the street. And for me, that's worrying, or maybe not worrying, but that speaks to what we need to address as a whole in terms of, are we inclusive enough of homeless communities and the solutions that we need to address why they say no to shelters. Also, one concern of mine moving forward is, I think the idea of shelters is important. I think it's something that needs to be, that we need to have building space in terms of how they run. It's important facilities for residents with special needs. It's important how the shelters operate. Is it an overnight shelter? Is it transitional housing? Is important. But I think as if we're going to move this to the next level, we also need to address the issues that push people into homelessness, push people into substance use. And I think we could take away all the homeless people on the street now. Let's say in the perfect world, you remove all the people from the street now, there'll still be push and pull factors that push people to homelessness, where you have a new homeless population by the end of 2021. And so these are the kind of things that, in terms of our collaborative expertise and the relationships and partnerships we're building, not just with social development, we need more people in terms of governments involved and society, because we have residents of communities calling the police on homeless people. We know what happens when you call the police on homeless people. The police have to respond as police do. So hopefully it's not just about addressing government failures, it's about addressing our failures as individuals, as different members of society as well. I hope that makes sense.
Thank you, Sasha. I mean, just highlighting the fact that it's complex. There are many faces to homelessness, ranging from people dealing with mental health issues to older people, young unemployed people. And in the MMC's clip, he was also speaking about the vision of tailored responses. So it's not a one-size-fits-all response. I think you touched on shelter. And I think shelter is partly also, I mean, there are different factors, but also the absence of affordable housing. With older people, there's no affordable housing, and it pushes people to the streets. I wonder, my next question was a follow-up, but most of you have actually touched on what I wanted to ask next. So I want to pause here for a moment, if it's okay with everybody, and open it up a little bit so that we can get participants to engage based on what they heard and also what you introduced just now. So I want to ask to open it up, and if there are any comments or questions at this stage for people to perhaps just type it in. I'm surprised that the chat room is quiet, that there's no responses yet. So any questions or comments, please type away, and I will then direct that to the panel. If we can do that. And also just note, Emmanuel was saying there, if you have a problem with connection or whatever, that the documentary is available on that YouTube link, and I'm sure we'll also send it to you afterwards. But let's hear if there are any questions or comments at this point. Maybe as people think about it, I'm going to ask Malene, maybe you have touched on that, but I wonder if you want to elaborate a little bit. What would you say is the main obstacle? If you must, there might be many, but what would you say is the main obstacle at the moment to ensure sustainable pathways out of homelessness?
Stefan, it's impossible for me to only give you one obstacle. My God, I can give you 10 now, you know, so please allow me at least to give you like 2 or 3, you know, because there are many obstacles and there are many main obstacles. So I think for me, as having a law background, the issue of the policy lacuna, the gap in the system, and the lack of accountability and responsibility by national government. You know, we often talk about the municipalities and the role of the municipalities and the role of the provincial national government. But they are not falling in line because of the fact that national government has not taken responsibility. They have not developed, a national policy that deals with homelessness. And of course, that is very important because it's not only the Department of Social Development, for example. The issue of homelessness is a cross-cutting issue, cuts across human settlements, home affairs, economic development, the Department of Education, Department of Social Development, health, and I can mention a whole range of government departments that plays a critical role in solving the issue of homelessness. And so at this moment in time, everyone, the NGOs, civil society is operating in a vacuum. They're operating in a gap that is not clear. And where there's no policy direction, there's no budget allocation. There's no proper human resource allocation. No one knows what to do at what time and when. We are not able to monitor and evaluate the impact of any policy because there's no policy. There's no short, medium, or long-term goals or objectives in place where we can actually monitor whether or not the plan that we have in place is in fact working or not. That is a serious concern, and that needs to be addressed, number one. I mean, even the Minister of Social Development, she made a very strange statement a few weeks ago where she actually said, well, I'm not sure whether or not it is my mandate. I mean, if the national minister is not sure whether or not the challenge of homelessness lies within her portfolio, what is the hope for provincial governments across the country and local governments to do effective work? I have a challenge with governments monitoring mediocrity. Honestly, I have a challenge with people celebrating mediocre success. You know, you cannot celebrate success if thousands of people are still living on the streets. So we need to have clarity in terms of that. The second thing that I would also consider to be a major problem is policy development in isolation. You cannot be someone that develops policy without consulting the homeless population, without consulting the NGOs, experts like Raymond and Wayne and Sasha, people that's been working in the space for a very long time. You see, when I worked at the Constitutional Court, Judge Albie Sachs always said that people would be more accepting of the outcome if they were part of that decision making. Homeless people want to see their lived experiences, reflected back at them when they look at the policy. They want to see themselves in that policy. And if they do not see themselves and they cannot hear their own voices reflected in the policy, they will not take accountability. No one will take accountability for that policy because government did it on their own, volition. So hearing the voices, opening up the public platform, and I'm not talking about public consultation. There's a huge difference between public consultation and public engagement. Government should stop consulting people. Consulting means I will tell you what the next steps are. Engagement means you tell us what you think needs to be reflected within the policy. You tell us what the gaps are within the system. And with that comes a lot of humility from the government side to accept and open up these spaces to the general public to also give their inputs to make policy more effective. We need effective policies, and the only way is to hear from the people that is being directly impacted by those policies. Another one, the societal attitudes, their mindsets and behaviors towards homeless people. I mean, I learned quite a bit, I must be honest with you. And the majority of South Africans still treat homeless people like criminals. Let me just tell you, you need to educate yourself here. There's many push and pull factors that brings people to the street. And what does that show us? It shows that there's a lack of advocacy. There's a lack of campaigning around raising awareness about the issue of homelessness within civil society itself, educating people about why people become homeless. Of course, there are some of those elements, people that's in society that has a criminal background, etc. But that's a minority within the whole broader scope of the homeless population. So I think that advocacy also is a huge challenge. And I'm not blaming the NGO sector per se, but I do think that it falls within our scope. I'm an NGO, and I have obviously reflected at myself and my role as a head of an organization that deals with women and abused women, etc. How can I play a more active role in raising awareness about that 12-year-old girl that is a prostitute today, that has to sell her body on the streets because there's no other way for her to say she's running away from her home. Social workers or the social system has failed her dismally. How do we deal with those kind of things? How do we become more empathic and more compassionate in our responses towards homeless people as civil society? I mean, I can go on and on, but I'm going to give my panelists an opportunity to respond as well. Stephen.
Thank you, Malene. I think I'm gonna not have you respond to obstacles now because there are some questions coming up, and I'm just struggling here to see all the questions properly because it jumps There was Mary was just speaking, and I think Mary echoes what you're speaking, Melinda, the lack of policy at all levels of government, but actually the lead that should be taken nationally. Themba, thank you for interesting reflections. A concern how much what was achieved is sustainable. What's most urgent right now is to keep the momentum, so to say. And he was also noting the differences across cities. I think that's important. Marita, how did various cities deal with the influx of illegal structures erected by street people during COVID, with regulations that no person may be evicted? Not all street people to be truly homeless, but as of choice prefer to stay where their chosen lifestyle is being sustained, where more opportunities exist for jobs. Our engagements confirmed many people sleeping on streets were evicted from backyard shacks, or they don't have transport fees in efforts to search for jobs. Just maybe on that, is there any, maybe there's a follow-up from Marita, is it a city's mandate to provide housing to all migrating from their home province or city to new areas? Interesting question. Let's hear perhaps Raymond, Dwayne, Sasha, if you want to come in on that specific issue. You know, I think that the issue of what's truly homeless, of course, can keep us busy for quite some time. You know, also the matter of choice, I guess. We don't want to go back to a situation where there's pass laws and you know, those kinds of things. So do a person have a right to move from province to province? I think that's, of course, the right of individuals. But respond to that question. It's a question that people are asking. Raymond, Wayne, Sasha.
I can. While Raymond is struggling to unmute himself, I think just on a practical note, in terms of the one of sustaining the practices, that's a very important question. And what has been helpful for us in Tshwane is to think about subsections of homelessness. So we've had a strong focus on older homelessness, and if we then to put a lot of energy and an engagement and building a system to ensure older homelessness is eradicated, that older people that are just on SASSA grants, that have no access to no support services, are able to access some form of adequate and of decent and humane housing that is secure and tenure, and that people, and I think if we work on subsections, we are able to deal with this elephant piece by piece in a sense. So that's one, and that we are able to sustain this process by understanding not one size fits all approach. And I think then secondly, it's this question also that to say we constantly respond to crises. And I think worldwide, we don't need more analysis that we are in a very precarious situation, that in South Africa with the high inequality rate. And I think we need to start to build on processes to ensure that we do not have to respond to a crisis, that homelessness will no longer be an emergency because people are able to access accessible housing in well-located areas and support services. And then I think finally, with this remark, would be to say around housing, we need to engage as civil society frameworks of the government. I wonder in how far many of us in civil society know of the IDP processes of government, of understanding of zoning laws, understanding of who decides what can be built and where it can be built, and what do we have to do to engage those processes to ensure an inclusive housing. And I think a city like the city of Tshwane has boldly stated in their 2055 vision that the city is a city to home for all. Our intro to our constitution says, for all it's the people. We talk about the people, and I don't think we need to. We must go and ask the question. But where do you come from? Where do you have a home elsewhere? I don't come from Pretoria. I come from Joburg, and so if we start to ask these questions, then many of us would say, "But go back to where you came from." And I don't think that is an inclusive vision that we have for our society in general. That we need to say we need to ensure that we build and that we develop that is inclusive to all. I think our starting question must not be, how do we include foreigners? How do we include homeless people? How do we include migrants? But your starting point must say, all must be included. So how do we get there? How do we ensure people are included and that we don't discriminate in any of this? And the reality is urbanization is on the rise. That's going to be the reality. We need to grapple with that. On our continent, urbanization is not going to stop. And either we can try to keep people out, or we can say, we are here, let us create an inclusive society that's transformed, that this young girl that Melanie has referred to, that she does not need to do that, but that we have systems and societies and societal attitudes that ensure all are safe and that no one has to go hungry, no one has to sell themselves, or old people have to be on the streets.
Can I just ask, thank you, Wayne, those are important reflections. Can I just ask the panelists to try and keep it a little bit shorter, because it's a range of questions still coming up and we want to do justice to that. Raymond, do you want to add anything to that? The migration issue, all of those challenges? Yes.
I actually wanted to pick up on a point that Meline made about empathy, and I entirely agree with you. That's the most recurrent theme we've seen in our work here at in Durban, is that once we give people an opportunity to engage with homeless people, to hear their stories, to meet them face to face, the attitudes change dramatically. So the irony is we serve about 2,000 meals a day from the centre. And we always say that if somebody turned up and offered to provide all the meals, we would turn them away. Because one of the big advantages of our operation is that we give an opportunity for volunteers to come in, to meet the homeless, to work side by side with the homeless, because they're also helping prepare the meals, and that changes attitudes. So one of the ironies of the lockdown is that we found city officials who before had been involved in homeless issues but never left their desks and never stopped sending emails or attending meetings, were actually engaged in the emergency shelters, and police officers engaged in the emergency shelters, and they honestly came out of their way to say to me, I've got to know some homeless people and they're really quite nice and they're really just like us, and they could be my brother or my sister or my son or my daughter. And that does make a big difference, and we have to keep doing that. We can't stop doing that, and that's a major part of the work of organizations like ours. And that's why we benefit from the links with faith-based communities, because they are often well placed to do that.
Thank you, Raymond. That's very important. So that proximity, I think we've also experienced it in Gauteng with officials and so on, that just social workers who say, for the first time we actually did social work and we worked with people, and suddenly their understanding of their own department has changed and what their actual department should be doing, just because of the proximity to people who are suddenly people with names and faces they can have a relationship with. I wonder, Sasha, if you want to dare respond to Zandile's difficult question, the concern of people leaving shelters. And then he made some suggestions which ties up, I guess, a bit with what Raymond is saying about empathy, about dignity. But yeah, do you have a comment on that? Because I think we also experienced it in Tshwane. There's shelters people left from and shelters people stayed at. Anything you want to comment on that? You know, and it's not by force. I think Zandele's concern is also not that people must be forced to stay, but how do we create shelters that are actually such that it helps people to be reintegrated with dignity into society eventually?
And this is something I'm grappling with myself. I think often when we think of shelters and places of safety, we think we're the solution. And it's the very nature of this type of work, is that we do want to do good, we do want to help, we do want to assist, but sometimes the rules that are put in place in these shelters are not conducive. I know one of the big challenges the city of Tshwane had is that I don't think they were receptive to the advice given from the NPOs as to how big the shelter should be. And so often you had shelters of 200 to 300 people, and not being able to meet the individual needs, and it almost became, it was a prison in my eyes. And so I think when it comes to shelters and places of safety, I do agree with Meline and Raymond to say that we do need people who have been in that space to guide us in terms of what the needs of that community are, so that we're responsive to that community. And so I think freedom of movement, freedom of choice, understanding that, for me personally, they're not people watching me all day, what I do, how I spend my money, and then to be told it's wrong all the time can sometimes mean people are in a position where they say, you know, I'd rather put myself in a situation where I'm in harm rather than letting someone else down. And so that speaks to, you know, there are a lot of homeless people who would rather let someone else down than put themselves in a position where they could benefit. And so I think it's the empathy that we're talking about, the understanding, you know, skills development, I think is important, but I don't think it's the silver bullet. I think the one thing I'm really worried about post-COVID is the economic consequences. And I think the reality is, if we think homelessness is a challenge now, it's only going to increase. And so how do we tackle that? When our shelters are full and there are more and more people becoming unemployed, how do we tackle that? And so that's something that worries me going into the future.
Thank you, Sasha, for that. We have about 10 or so minutes left. Debbie raises this important question of prevention, and I think also that's not a quick response, Debbie. Others might want to weigh in, but perhaps just to say that one of the shifts that we're very aware of is that the population has changed so that it's much more a young, unemployed population. So you think here of it's macro issues, macroeconomic issues, rural poverty, all of that won't change overnight. And then that's an African issue. Urbanization is an African issue, and a few quick policy decisions won't just curb urbanization. That's the reality we have to face with in terms of African cities. So it's much bigger than what we think on the one hand. On the other hand, the fact of tailor-made solutions. Not all homeless people have the same issues, and I think some of the prevention also comes in there. The policies, for example, around older people and people with mental health issues in South Africa at the moment are all about deinstitutionalizing people with the assumption they will be turned back into communities that are often extremely poor and struggling without access to the kinds of stuff that needs to support people. So in the absence of proper facilities for people with mental health issues, older people who become homeless, people will be. So one of the prevention mechanisms would be to create proper housing and proper access, not shelters only. And I think so. Manine, you talked earlier about human settlements. In most of our cities, human settlements are very absent from this conversation. It's a social development issue. It's a charity issue. And I think we should say it is a social development, it is a health, it is a housing, it's an economic development issue. All these departments need to collaborate. It's just here, there are a few more questions. Selina made the important comment, could there not be a collaborative effort to count people? There is a process with Stats South Africa. I wonder, Raymond, if you want to say something about this, because in eThekwini, you did a count and you are quite confident in the count that you've done, that it is, well, as reliable as it could be. But I think sometimes you have a sense from Stats South Africa, who are our partners in this, that I wonder if we don't overcomplicate it, the whole issue of enumeration and all the theory around enumeration, whilst with NGOs on the ground, people have a really good sense of where people are. And so Selina's question, do you want to respond to that perhaps, Raymond, just from your experience of counting in Durban?
Yes, so we did a very substantial exercise with the Human Science Research Council, funded by eThekwini, rather ironically, 4 years ago, and counted, not only counted homeless people in a particular area, but also found out more about them. And actually that's key to any exercise. It's not just enumerating, but actually understanding a profile of the homeless. And if anybody wants a copy of that, I can share the link. What's important about counting is that we don't become obsessed with the numbers. Clearly, we found 4,000 homeless people in central Durban. Our responses to the homeless are not going to change if instead of 4,000, there were 4,200 or 4,600 or 4,892. Clearly, the exact number isn't the issue. But the fact that it's 4,000 and not 10,000 does make a difference. The fact that it's 4,000 and not 400 does make a difference. So similarly, at a national level, it's helpful to have a single definition that can be used for account, and that was the basis of the discussion with Stats SA. And what we discovered in talking to Stats SA is that they were failing to enumerate. They counted, I think, 2,000 homeless people nationwide in the last census, and simply because they had a flawed way of trying to assess homeless people, and effectively homeless people ran away when their enumerators went in to try and count them. So we talked to them about how important it was to have an appropriate process for the kind of people they were trying to count. But as I say, let's not get too het up with the numbers. My general sense is that the number is a manageable number in each city, and unfortunately, it can sometimes be a tactic of municipalities to inflate the number, because to then say it's too big a problem, so we can't do anything about it. And there is an advantage in keeping it to a contained number. Not that you can't broaden the definition, but the broader you make the definition, the less likely it is that you will actually take any action. And I'll post the link on the chat, as somebody suggested.
Great, thank you. Thank you. I see Temba asked for that as well. Alison, kind of similar to what I was raising, Alison raised the question of what effect has the fact that human settlements shift responsibility to social development. What effect does that have on support and delivery? I don't know, Malene, if you want to weigh in on that, perhaps, just the collaborative or the lack thereof. I don't want to put you on the spot, but if you want to come in there, perhaps.
Yeah, no, it's a big question, you know, and a massive challenge also. I don't think that they're shifting the responsibility. Human settlements is not shifting the responsibility. They are just not reacting. That's the problem. You see, what needs to be done here is a whole revision of the national housing policy and all the national housing plans. That needs to be amended. There needs to be room for transitional housing. The government, the National Department of Human Settlements, even the provincial departments need to be open to amend their policies to include homeless people on that list of beneficiaries. Currently, we have 400,000 people in South Africa on waiting list, waiting for a house. So I mean, it's not a matter of shifting. It's a matter of not having the political will, not being willing to, reallocate budget or to increase budget to build more houses or to deal with the issue of lack of housing effectively in South Africa. That is it. There's nothing. There's no cross collaboration. No wanting to shift the blame. There's no political will from human settlements to deal effectively with housing, and for that reason, there will always be a shortage of housing and a lack of prioritization of budget towards housing.
Great, thank you. So we have to engage Minister Sisulu on this issue because the political will is lacking, is what you're saying. I think let us try and wrap up in the next few minutes. There are one or two really important questions still here. This is helpful, and it goes back to some of what was said. What type of process would be seen, Georgia May, as appropriate for groups like Stats South Africa, who are going in just to count people as opposed to actually speak to and build relationships? So it's the posture with which we do some of these things. I think it came out from others. I wonder if any of the panelists want to respond to that. I mean, Stats South Africa is actually at the table. They're keen. There is a journey. Maybe also the National Homeless Network needs to hear this, that perhaps that should be a specific strategy going forward to do the counting in different cities. But how do we, maybe to Georgia May's question, how do we support groups like Stats South Africa and other government departments to adopt an approach that is more relational, that actually listen to people? Wayne, Sasha, Raymond, Malene? How do we do that? I mean, of course, you can only do it if people are willing to engage on that. But any thoughts on that, perhaps?
Yeah.
Yes, Raymond, please.
We had a great example of that in Durban with the Independent Electoral Commission and the national election last year. So we identified that a huge number of homeless people who are South African citizens were not registered as voters and were entitled to be registered. We went to the IEC, and to our surprise, instead of them turning us away, they said, fantastic, our job is to register all the people who are entitled to be registered. We have struggled to get homeless people registered. Can we work with you? So we did an exercise with them over 6 months to identify homeless people, to ensure they had IDs, to get them registered, the whole exercise in voter education. And we had people literally in their 40s who were voting for the first time in the 2019 election. So clearly there are large parts of government that are not willing to collaborate, but there are very many places, IEC, Stats SA and others, who are willing to collaborate. And I think we use those then as good case studies to show what can be achieved in collaboration, which is not just to the benefit of the homeless, but to the benefit of those departments. They have targets, they have goals to meet, and we can help them meet those goals.
Thanks, Raymond. There are, yeah, Sasha.
Just to add, one thing I've noticed working with medical students, sometimes we can be very entitled, is COSUP and rotation and exposing people to the challenges that the communities face. And that, because we all have our bias in terms of how we address people. You know, I wasn't always involved with COSUP in the Department of Family Medicine, and so being on the ground allowed me to see people differently and engage differently to respond to those problems. So if we look at someone like Stats SA, and the question is, how do we build that relationship? I think ComServe is, you know, teachers could even go through ComServe. Sometimes they're quite entitled to, but in terms of how we build people up in terms of understanding the challenges people go through, that could be a solution. And I think the medical students grow greatly from the experience of working with people in the community.
Thank you from that personal experience. So it's to create those spaces quite intentionally, to allow the homeless community to be our teachers, because we who are not homeless don't know, and we will never know. We will always know secondhand. So I think that is vital. And so thanks, Sasha, for that input. Alison was just saying, and I think this is something we need to take note of and engage with, the Social Housing Regulatory Authority, looking to expand the definition of the types of housing, and we really need to be at that table to engage that conversation. And then just a clarity question earlier by Buslokwa: was the response of homelessness during the lockdown led by the NGOs in all cities with little intervention from local? I think no. I think it's more complex and nuanced than that. In some cities, local government clearly gave the lead. In some, there were really great collaboration. In some, NGOs probably dragged local government to the table. In some, the real, like Chris Lund was saying, the real conversation started now, almost a month or two ago. But I think there are cracks. There is good news, and we have to weigh in. We should not stop. And that's partly why this is conversation. And there are new people in this conversation that we must make sure that we stay connected for the movement to grow bigger, and for the narrative around homelessness to be shaped in a different way. I'd like to ask for us to do a closing few comments. Wayne has also just shared that information with you. But if I can ask, starting with Malene and ending with Sasha, just in facing homelessness, facing homeless persons, how does it make you face perhaps yourself, your own organization, and what role do you think does each one of us have to play? Malene.
Thanks very much, Stefan. Okay, so during my experience over the last 2-3 months, and having interacted with so many abused women, you know, women that is currently prostitutes on the streets of Cape Town, etc. And I mean, for me, I mean, I am supposed to be a gender rights activist, a human rights activist. I've always been working with abused women, but women that was living in houses, not women that lives on the street. And so obviously it has totally changed my mind in terms of my activism and my advocacy and the work that we would like to do under the Women Lead movement going forward. In fact, it is my intention, Stefan, to actually apply for one of the safe spaces, to open up a safe space, a specialized safe space for women and the LGBTQIA+ community. Because the LGBTQIA+ community is also not a catered for community on the homeless on the streets of Cape Town, or in fact in South Africa. You know, they are being exploited sexually by various elements on the streets. You know, and those are the kind of people, those are the kind of marginalized, vulnerable people that my organization organization is supposed to protect and raise their voices, you know? And so obviously it has forced me to look at my own work, my own worth, and my organization in a different way, and see how we can play a much more impactful role in reducing homelessness and protecting the rights and interests of the homeless people in the city of Cape Town.
Stefan, your mic.
You didn't tell me. I was speaking for long. I was just saying thanks, Malene, also for being on the call and for bringing that gender aspect so strongly in, and also the LGBTIQ community and strength for the process in Cape Town. I think we're all watching in anticipation how Cape Town moves from Strandfontein to another place. So strength with that. Wayne, maybe a word from your side, just in terms of the same question.
I think being involved in this space for so long, it can wear you down. It can, you can be disheartened, but to see the great things that have happened gives one new energy, but also to see those lives being transformed that we journey with. And I think it was this, especially this time, has been to remind me why why is this my vocation? Why is this my calling? And to be transformed, and not just to be beaten down by the system, but to learn from the homeless communities, to learn resilience, to learn what it means to be generous, to learn generosity. And that I had to relearn this year again during this last few months, to on a very theological and a soft side, to say, for the hard heart to be broken down, and not just to fight, but also to learn again to what it means to love and love oneself. And I think these things are, we want to talk about policy and hard infrastructure, but there's also the soft stuff that is so important to change hearts and minds and perceptions. And I think it's for myself to be constantly reminded who I do this for, who I do this with, and that it's not about me, that it's about this us and the collective. And that's the only way to go forward.
Thank you, Wayne. So Simon, homelessness seemed to be one area that really exposes us to the fact that our inner lives and outer public stuff, the personal and the political, cannot be disconnected from each other. And I think as you speak, that is clear again. Raymond, from your side in eThekwini.
Yes, I would support that and say that as we do that for ourselves, we shouldn't be scared to do that or to encourage that among the people we interact with, the officials. There can be a temptation. I know I fall into this trap all the time of treating officials as the enemy. They're people whose consciousness has not yet been raised. And part of my job is hopefully to raise their consciousness. And one of the things I'm surprised that I'm still surprised in this work. There was a lovely incident very early on. We set up an emergency shelter. I can actually see it from my window now at North Beach, where I live and where there are people living in big blocks of flats. We set up an emergency shelter behind one of the big blocks of flats. And I was standing there one day, and a very fancy car drove up with two people, and they stepped out and they said, "We're from that block of flats." And I thought, oh my goodness, they've come to complain. And before I was about to go into apology mode, and they said, "We've been watching what you're doing, and we want to know, what can we do to help? Can we come and bring chicken and chips for all the guys?" I said, "Well, yeah, there were 200 people here." And they said, "That's fine, we'll bring chicken and chips for 200 people." So we kept seeing through lockdown great examples of generosity by the general public, by municipal officials, by police officers. Not always, not everyone, but enough of that to remind ourselves that this is something where I think people can be naturally generous when they're encouraged, and that homeless people can help that happen and can respond to that and can make it a collaborative effort, because our cities will be better for everyone if we're working side by side with the homeless rather than treating them as a problem to be solved or as litter to be cleared off the streets.
Wonderful, thank you so much. Our cities will be better for everybody if we start to place those who are most vulnerable at the center, at the core. Sasha, you have the opportunity to have the last word.
For me, it's been a great learning experience, and I agree with many of the sentiments shared. I think one of the things that you know, one has to also reflect on one's own behavior constantly in terms of how they address and see people and homeless people, and grow their sense of community all the time. And so I've, you know, been privileged in Tshwane to work with doctors. I've seen Dr. Stonehouse, Dr. Yesa, Wayne work tirelessly. Many volunteers work tirelessly in shelters, sometimes in many instances 24 hours a day, 7 days a week, just keeping on pushing when there's no real reward, sometimes at their own expense. And so yes, there were things that got me down in many stages of the lockdown, but I think the one thing that we must never forget is that there were a lot of people who pushed really hard in different parts of society to make sure there was a response, and to also try keep that momentum all the time and not burn out. And so but it is something that we definitely have to keep pushing for, and to grow the network. The Prof in our program, Prof Hugo, always speaks about collaborating and working together to solve solutions, and to, you know, first it's the Homelessness Forum, then it's Doctors Without Borders, the various NPOs, government, and just to keep growing it, you know. And it's grateful. I'm grateful to be part of this discussion, because it exposes you to different people who are doing good work, and hopefully we can come up with a model which we can all tap into and all apply, so that it's not one city doing well, it's all. And hopefully it's a model that we can replicate and build quite into a sustainable model. And I think, you know, one of the questions it was, can it be sustainable? I think it can. I definitely think it is something that can be sustainable, but we need to share that information and not necessarily be defensive. You know, I think sometimes we're always defensive around certain things, and, you know, we're painted with a certain brush, politicians are painted with a certain brush, homeless people are painted with a certain brush, to understand that we're all people at the table, and let's make that table bigger.
Wonderful, thank you. It's almost like, you know, what I hear sort of between the words that you're saying is the need for a new kind of leadership that will actually cross all these boundaries, debunk the myths about all of us, and say that the purpose should be to end homelessness one person, one family at a time, to open the cracks, to create a new narrative. The cliche new normal, these shared values, these kinds of conversations, the new movements should become the new normal, because we need to work in a different way. So thank you so much to the panelists for joining us this morning. I hope we, every time there's a new person coming on board, we hope that the movement, the connections will become strong. Because indeed, if those who are homeless and NGOs and government and the academy can all, and NGOs can all join hands, we might actually go to new places. So thanks to you, thanks to the participants and those who were streamed in to Urban Fest for hosting us, and continue with what you do as best as you could. Thank you all, and cheers. Take care.